no, it wasn't too heavy, because I think, unfortunately, a lot of people to a certain extent can relate to that.
Yeah.
Yeah.
I know, I did worry after. I was like,
through our own perspective, I guess. Should we come back? Or
should we come back in? Or do you come back in here? It's really strange,
I
isn't
feel
it?
I'll be sacked now.
No.
You're the worst.
The other day here.
You are the worst.
Hello.
Hi. Alright.
Okay.
I don't need to write it, do I need to write it?
Well, you don't need to write it. I prefer to go last, folks, if that's okay. All right, as a good observer. The introduction was good. I'm talking about the therapist now.
Yeah.
The introduction was good, but I feel that was quite too brief. Speaking up, as in the tone of voice, I feel that was quite too low as well. In as much as we're not shouting, but at least I feel we could talk a little bit more for. Then the listening skill, very wonderful. The facial and the eye contact, very great. Paraphrasing, good. Clarification of ideas, very good. Empathy, good. But then I would rather make the client feel more that I know where she is. Then summarizing was good, but I believe you could do more. That's what I've got.
Can I ask me? Empathy, what do you mean?
Empathy, like putting yourself in her position, as in, yes, I know where you're coming from, I understand what you mean. Your problems appear to me, yeah, like something I know about, you know, but like when you were dealing with it,
Yeah.
you were just giving your ideas and doing your wonderful job, but I didn't feel this person knows what I'm talking about, as in he's not coming from where I'm coming from.
Okay.
Yeah, you are, but I feel here, like I said,
Yeah.
you know, we could do more to, like, you know, get your client carried across, carried along.
Can I ask you how you
Please.
think I could do that?
All right,
Like-
good. Yeah.
Yeah.
For instance, like last week where we did what we
Yeah.
did, and after the introduction, and you were talking about the kids and issues about what we're doing. At least I was able to, like, oh yeah, I do understand what you're talking about, especially when the kids are involved. All right, you know, at least without telling you about kids, you already now know, perceive from the tone and my approach that, yeah, perhaps he has a kids, and you know, well, you did good there from my own little assessment, but I believe we could do great, you know, to add more to it. And then like the summarizing part of it, the conclusive part of it. Yeah, thank you very much for coming and, you know, having time to share your views and concerns with me. If you still need me at any point in time, feel very free. Get in touch. You've got my numbers, you've got my details. Feel very free. You know, we encourage the client again to feel free. You know, that trust you guys were talking about. See me as somebody who could, you know, do things. That's my little perception. I don't know.
Can I say about
thank you. Thank you.
I feel like I get where you're coming from, Viv, but this, I think if you had said like I think she empathised, but I think if she said like, I think I understand can be used a bit too freely, because you don't always understand. And if Kata hasn't ever had my situation or been in my situation, and if maybe the better phrase would have been, I can see or I can hear that your experience is difficult for you. I think if Kata had said, I understand, it'd have been a bit like, but I would have maybe questioned, does she understand?
Yeah, I think I can see your experience is
difficult would have been a different way of
really good
emphasising.
phrase, which I guess could use.
I can see this is difficult for you. rather than I understand.
Yeah, that's very good. Thank you.
Okay.
Yeah.
I thought it was a really, really nice sort of session. It felt, I don't know if I was watching it on the screen, but I think it seemed to feel very comfortable. You seemed really quite comfortable in the moment. You started really honestly as well. I think you introduced yourself and you said you were excited and nervous to be there. I wasn't sure about nervous, but excited. You made her feel immediately like you sort of were there to listen fully. And you really let her talk to begin with, and she just, you know, you didn't, you know, you filled silences and you sort of let her go, with minimal prompts, and there was a lot of like active listening going on. Like, my notes are all over the place, by the way. I'm going to put it on there again, but you have a really soft voice, and I think that you were had good reflection, and you was talking and focusing on her feelings as well. You did say at one point basically. You said basically. I didn't get time to write it down because I too busy writing things, but you said they were basically you feel or something like that. And I thought it just tends to be a tad challenging, but you know it was something. And you didn't seem to respond to that in that way though.
No, I didn't pick up.
But then I put that gained the desired effect though. That's it, because you did respond to that, you know, in a positive way. I thought you managed the silences really well. You was nodding and conveying empathy. You said something like, what do you think and what you do in reality. You picked up the idea, she kept saying the idea of normal. I thought you picked that up and you said the word sticks with me.
Yeah, I like that.
Yeah, I felt that you did, it seemed that you did, and that you kind of did digress a bit more then. And you kept coming back to this desire to be normal, what is normal, happy in yourself. And you asked her, you would clarify, is that the right thought? And you said, looks to me that you treat yourself differently than how you treat others. Sort of, you know, just the point I think came out that you were trying to, this idea of normal. And I thought that it was a lovely reflection and the summary, just how you made her feel like you'd enjoyed your time with her and you were thankful that she'd shared this with you. And I think you felt that you'd probably like to come back and continue and you'd be happy to. But that's from a...
That was very genuine. I really
it felt
sort
that.
of, I felt like I appreciate that you shared.
Yeah.
However, did you feel like I have to be more empathetic? That it was not enough empathy?
No, I felt it was empathy. I thought it was just nice and subtle, but I think as a first kind of contact with her, that was like it felt like you paced it well, and you interjected as she shared more and pushed a little bit then. So you know, I thought you did. I thought you felt that it was quite empathetic. I was wondering about your body language at first, but I felt like you'd almost got yourself into a position and then you didn't want to kind of move.
That was a truth, partially.
Yeah.
They had this
It was like,
phone,
go.
which didn't work at all,
Sorry.
because I was supposed to be checking the time because our
It's not
not
working.
working, so we had
And
to
I think she was
Had
finding
good
it, she was
action, I
finding
think
it
you felt.
difficult. She was finding it difficult to ask me, what is it time?
That was because we said last session that we need to
To
sort
be
of
looking,
to
we'll
be, so
work
it's
it
more
out.
convenient to check the
Sure.
time. And my position, I was trying to mirror a little bit.
Yeah. You look comfortable, but
Yeah,
I just
I
thought
was trying
initially,
to
had you
mirror a
been
little
sort of
bit.
stuck in that position
Yeah,
and didn't want to kind
yeah.
of move and get, you know, potentially, but yeah.
Yeah. A few times I wanted to move and I thought, is that the should I
Try
be just
out
natural
anything.
and move, or should I just
Natural.
stick?
I mean, that's the approach I believe. Try out anything where I get it wrong. I mean, I'll be corrected instead of not trying it at all.
Yeah.
You know?
Okay, folks, I'm going to give my feedback and then have to dash. But what I want to do is I'm learning people's names. I'm going to ask you to say your names.
I'm terrible with names.
Yeah, it's just as we work together, I really like to get to know
Yeah.
each of you by name. So,
I should have
Where
been.
about?
Yeah.
Katya.
Katya.
Katya. Yes.
Okay. The name that came up on the screen.
It's Yekaterina. It's Yekaterina. It's my full, but I'm just sort of
So you
introducing
prefer
myself.
Katya?
Yeah.
Yeah, that's fine. It's just but okay, Katya.
Shannon.
Shannon.
Sarah.
Sarah. Okay.
So divine favor.
Okay. Okay, that's brilliant. Okay, Katya. So, how I do my style of feedback really is I like you to do your own feedback, and I'm going to ask you questions. How was the session for you?
I felt very intense. I think usually I do feel more relaxed.
Yeah.
But I guess it's natural, and I have to get used to that idea that I'll be supervised, and
Yeah.
at some point I have to be comfortable with
Okay.
being supervised. So I think it's something just will hopefully one moment will make me feel better.
Okay.
I really like that. I felt that it's genuine, the problem, and
Yeah.
I really felt like privileged to hear it.
Yeah.
What I was trying to do, I guess I was just trying to understand the real issue. What is the real issue? The issue, the weight of the issue, the how you treat yourself. That you just basically too tough on yourself, and I was just trying to give that
Okay.
sort of to make the message that you are being very tough on yourself, and is it worth it? Is it what you really want to do? So have I achieved that or not?
Okay.
I mean, like, I would like, maybe, I don't know, maybe I wasn't empathetic enough.
You were.
Okay.
Maybe that's the point which I
Okay.
need to consider, because I don't think I ever said this. I can see your experience is difficult. I
Yeah.
don't think I've ever mentioned that.
Okay.
Yeah,
We'll
that
come to
could
that.
be that.
We'll come to
The
that.
problem, yeah.
We'll come to that.
Um,
What?
Yeah.
This is the other bit about learning to be a therapist and using the interpersonal skills, is to go beneath the metaphors, beneath the narrative that's being said. What do you think your client was saying to you at a level of depth?
I think she was saying me that some people sort of made her not to love herself, and she understands that the other people's opinions or stereotypes that are society made her doubt herself, and she thinks that that's not really right way, but she's fighting or to feed that or to feed into that and accept herself through feeding into that.
Okay.
Or just relax, chill, and love herself how she is. And I think you're a very, very self-aware person, so that's why you realize somewhere there. But the conflict is there, and conflict doesn't make her really be happy with herself.
Okay.
I
Maybe the
think that's-
conflict is a good word. So there might be something about your client talking about her self-concept,
Yes.
stuckness, because you're saying, look, I've lost weight, I thought I'll be happy. So there's something about that. Conflict is a good word. There's obviously something about the past. So
Yeah.
there are lots of this. So reflections about offering all of that the client is not just verbally saying, they're telling a narrative for you to go underneath that. If you were to do something different, tell me 2 things you would do differently.
I would maybe put more empathy, I guess. I would try to sort of mention that I see how difficult is that for you. Maybe I would be more brave with expressing my vision of that's what I just said.
Yeah.
I guess I could
Yeah,
just
to offer it
I could
more.
just offer it more,
Yeah.
because I
Yeah.
felt it, but maybe I didn't find the right moment, maybe I didn't find the right wording, how to bring
Okay.
it out. I think
Yeah.
maybe that's 2 things I would do.
Okay. Well, my feedback to you then, Katja, is I thought it was a really good session. It was a good session. You started well. You started the session well. At the start, I've just said consider not sharing your feelings as much. I agree with what you've said around nervousness. Because if you said you're going, well, I'm nervous as well. Rogers' idea in the 6 conditions, he says that the first person we shall term, the person we shall term the therapist is more congruent, and the person who's the client
It's none.
is nervous, but you're not. So it's important for you to
that brave,
keep
you're
it
right. Cool.
You made some wonderful reflections. I thought it was really just spot on. So you're almost pushing yourself to open up, and you says, yeah, I was bullied, really good reflection. Sounds like your expectation does not meet your reality. It says, again, I thought it was a really good reflection there, that you said that. You said you're generally questioning yourself, and Shana said, yes, I am questioning myself. I don't ever think I'll reach my goal, I'll be happy. and I would have, maybe if you could have just tapped into that, what is this about her chasing this goal, but also saying, I'll never be happy? She's tying herself in knots by doing that. Yeah? So you might have wanted you might have wanted to reflect kind of some of that, because that's what's tying her. Is, well, if she's chasing it, and then she's thinking, I'll never be happy, it sort of undoes itself. I really love the fact that you picked up on, at times I just want to be normal. And you know, your reflection, that was really wonderful, and I've just said a really good challenge. You talked about acceptance of herself, and says, yeah, I find that difficult. And you were just moment by moment. It's very good. The bits that I think you could have done differently, actually, I'm going to agree with you and with Favour on this one around empathy. If empathy is walking in the shoes of the other as if they were us, then what I wanted to ask you was to say to you, what do you think it would feel like to be a 21-year-old who has this self-negative concept about the self and feels that, oh, they're doing it but they might never be happy, and to feel that, you know, the bullying from the past has really impacted? What do you think that really would feel like?
Very, very heavy.
Yes.
Very heavy.
So all those feelings is what I would share. You know, this really feels, you know, I'm really touched by that. It feels really hurtful. Feels really difficult. You know, I can really, so I think your reflection about understanding was right, because kind of like I'm really getting a sense of how much this is a struggle on a day-to-day basis for you. And that's empathy. Is I'm now walking in your shoes as if they were my own, but without getting lost in your
And
world.
not pretend to be them.
Yes. I'm not saying, oh, I understand what it's. No, I'm not. So that would be important. And my suggested focus for next time: offer more empathy, go at the deeper level. You've already said that yourself. Focus on the client's body language.
I had negative body language.
Yeah. So I might just say what I'm noticing. So there were times when she's saying, "Oh, it feels really sad," and she's smiling. So I might just look, and I notice you're saying that, but you're also smiling at the same time. Or she's, you know. So I just focus on the body language and just offer what you see, which is partly what we said in class. And lastly, what was done well. Overall, this is a very good session. And start to the work. You stayed with the client's frame of reference. You offered accurate paraphrases and reflections. So well done.
Thank you.
Okay.
So not like
All right. Thank you for having me, folks. See you later.
I will see you next week again, right?
I'll be with a different group next week, highly likely.
But I think the lecture, isn't it?
Yes, I am here for the lecture. Yes, that's correct. Yeah.
All right.
Thank you, folks.
Thank
Thank you.
Cheers, man.
You might want to stop.
Yeah, I was going to say it's still recording.
So, like what I do,
Yeah,
right?
they went to record the feedback.
Okay. That's
Kaji,
Yeah.
like what I do, I take all this.
Yeah. Thank you
So
very
that
much.
later on I
Yeah,
look
I've
at
just not done. I've still got
what I
lots of
did last
as
week.
well.
What I
But
did
most
last week, I
important feedback
snapped
from
it.
you.
I
You didn't really
snapped it.
tell me your
I
No,
feedback.
because I wanted to let him do his kind of react to go. I thought it was lovely.
It was lovely.
It was. I didn't feel. I was still nervous.
Do you want me to stop this while you charge? Do you want to carry on?
Yeah, if you want something, that's fine. I'm just, yeah.
It's not doing yours. So.
I don't mind to record that.
Oh, yeah,
because it's
if you-
still
yeah,
for me.
Yeah.
to learn.
Yeah.
I obviously felt nervous. I would have felt nervous with anyone about speaking about
By
it.
myself.
More nervous so because not
For
for
those,
you personally, but another person in the
Being
room,
there.
you watching.
Yeah.
Can't remember his name watching. So that's like all these people I'm telling this one thing to, which I don't even speak to really my other half about because we're not like I'm not really like that. But you've got like a nice presence about you, and I felt like you did want to understand where I was coming from, and I didn't get a sense of uncomfortableness or that I wanted to shut down. I didn't feel like suddenly, oh, I don't want to speak about this. I felt nervous when I first sat down. I thought, like, think about something else, don't bring this up. And then I thought, no, just stay with, because that's how I've been feeling today. So I thought I'd just bring it up. But so you didn't make me then go back on that and think, oh, actually, I don't want to speak about this. You know, I didn't feel like that. I actually opened up more, which I think says a lot about you as like a therapist, because I didn't suddenly stop or want to stop talking about it. I only stopped at the end because I could sense it being 10 minutes, and I knew it'd be more uncomfortable for you to bring up. It's like
pick up the
I
phone.
thought it's best for me as the client to kind of say like I think it's been 10 minutes rather than you having to feel really uncomfortable sat there for like 20 minutes, then you have to speak over the thing and be like, guys, stop. But it was lovely.
Was any of my summaries pushed you to think or to say something? Was there anything there?
The normal thing really stuck with me. I mean, the thing is about, for me personally with therapy, I kind of go off on my own mind. The therapist is there like to mention things to make me think, and then I don't even really think. I think what they just said triggers something off in my mind to think about other things, and then I think about, which is what therapy does. So what really I can't read back to you what you've said to me. I wouldn't be able to, because you've just prompted my thoughts, which is the most important thing. So all I can really think about is how I felt and what I really said. But the normal thing really stuck with me because you did make, the best thing is you made me question what I was saying without it being uncomfortable for me or without me getting defensive. You didn't say it as in, oh, so you think you're not normal. It was like, what do you mean by normal?
Yeah.
Which is good. Because then I was like, actually, there isn't a normal. So like, you helped me think about, why am I saying normal when no one's normal? So that's
Everyone's individual.
Everyone is,
Just
and I
everyone's
know that
individual.
myself. I want to be a therapist, so I'm very positive about everyone else but myself sometimes. So like you saying that really stuck with me. I was like, it brings me back to the places where I am when I'm okay. Like when I'm a bit down, I don't really think like that. But that's like brought me back to thinking, yes, no one is normal. Think straight. So I do think it was lovely. Like I say, I felt like I could open up.
Would you tell me if I would mess up? If
Yeah.
I would mess up, would you
I
tell
would.
me?
Can you tell? You can tell I'm being honest, can't you?
Okay, that's the most important thing
We
for me.
gotta
Of course,
we gotta
yeah.
be
I would
honest
tell
to
you.
ourselves.
Yeah,
That's
yeah.
the best way we can
Yeah.
achieve success.
Yeah.
The
Because
only
there's
thing is,
no gain after this 1 year.
yeah,
We become rubbish therapists out there.
Exactly.
You know, so if we
Yeah.
tell ourselves the truth, look, Favor, the way
Yeah.
you spoke was crap. Package it properly, you know.
no, well that's why when you said about understanding, I straight away said my opinion of that. I feel like if she'd have said because it was my therapy session. I said how I would have felt because if she'd have said that, I'd
And that's
been
the
a bit
issue,
like,
isn't it? That's the whole
Point,
point is
yeah.
that you've got a good relationship, so you can say that to her and she can.
yeah, the only thing I would ever say is that at the beginning it always feels a bit uncomfortable and I simply think I've been to therapy and it feels uncomfortable because it's like the first time and it's like how much do I bring up, and also we know everyone's watching, so it was only the first bit because realistically if I had an hour I wouldn't have just gone in there with that. I'd have kind of sat for a bit and maybe thought for a little bit but because I knew we had 10 minutes I kind of just offloaded.
Yeah.
So, but that's not your fault. That's just the way it felt for me.
I sort of, in the beginning, how I presented myself, I said excited and nervous. I still sort of stand by the idea. I just wanted to show I'm a human being and I have
Get that,
feelings.
yeah.
Maybe just nervous was the wrong word. That's all. I needed to choose more, I don't know, other words to express
Maybe
that.
say like
it was
I'm
just
happy.
nice, so, you know.
I'm happy that you know you're here and you're willing to talk to me.
Yeah, yes, yeah.
Yeah, so do we go?
Should we
Need
go
to
and
stop
practice
the
how
camera.
to... has anyone has thingy today?
USB?
USB.
I
Yeah.
got one.
Okay, cool. So we can practice how to save it maybe, yeah? Because it's only 30 days and we've done first one last week.
Yeah.
And then, sorry, if I might remind us again, have you guys been doing your reflective writing?
Yes.
Yeah.
Please, let's keep up to date every week.
Yeah.
Good people.